Hi there, my name is Lena Etuk at the Center for Social Impact. I'm a senior research officer here at the University of New South Wales. I've been asked to give a presentation on why we want to measure social impact for the State Library of New South Wales, in particular the library network across the state. So let's begin. Thanks for joining me today. So I just want to give an outline on what we're going to discuss today. First, I'd like to give an introduction to the Center for Social Impact and give a welcome to country. Also go over some key terms, why we measure social impact, and then discuss some things that you might want to consider in your journey into outcomes and impact measurement. So before I give the introduction to the Center for Social Impact, I would just like to show my respect and acknowledge that we are meeting and that I'm meeting with you today on the traditional land of the Gadigal people of the Eora Nation. And I pay my respect to their elders past, present, and future. So the Center for Social Impact is actually a research center that's a collaboration of 3 different universities across Australia. The University of New South Wales, Sydney, University of Western Australia, and Swinburne University of Technology in Melbourne. And our purpose is to catalyze positive social change. And we do that by doing research, education, and leadership development, and engaging with people, communities, and organizations to grow their capabilities. So it's all about catalyzing social change across the social purpose sector, so organizations that are doing social good. So next I'm going to talk about some key terms within the impact measurement or outcomes measurement space. So some of you maybe have heard some of these words and phrases before in the context of maybe measurement or outcomes measurement or impact measurement. And that would be maybe things like logic models, inputs, outputs, outcomes, impact assessment, outcomes measurement, evaluation, and monitoring. Now, all of these are words that you may come across in your journey on outcomes measurement, and some of them are very easy to understand and pretty clear, and some of them have different meanings, and so it's sometimes really helpful to be fully aware of what they mean, and that you may, as you're interacting with folks talking about these things, you may need to ask them to clarify what they mean. So I'll just go through and start explaining a little bit about what some of these words and phrases actually mean. So we'll start off first with a logic model. So this is what a typical logic model looks like, though there are some logic models that you might run across that look a little different. But essentially a logic model is all about articulating the logic or the rationale for how a program works and what it's doing. So essentially it starts with inputs. So what are the resources that a program or an initiative is using in order to do particular activities. So those inputs might be things like the actual dollars that are being invested in a program, the people time or volunteer time, or maybe the building space or a particular venue that you're using. So that's an input. And so in a logic model, you want to articulate all the inputs that are being used in a particular program. Then the logic model flows that if those inputs are used, then these particular activities will follow. And so these are the activities that your program is doing, such as running, constructing schools, or hiring additional teachers, or maybe offering an after-school program to people. If those activities happen, then there are particular outputs that will occur. And the logic model, as you can see, is very linear. So what are those outputs that are going to occur as a result of the activities? So in this example, there might be the number of new schools. Let's say the activity is building new schools, then the output is, maybe 2 new schools have been constructed. And it's all about what are the technical outputs of the intervention. So what are the things that directly result from the intervention that typically can be counted pretty easily. So in an after-school program, it might be the number of students that participated in the after-school program, and and it would be limited to that. Then the next phase of the logic model is to articulate what those outputs then translate into outcomes. And so those are the direct effects of a particular intervention. such as in this example, if we've constructed new schools, maybe that means more students can be enrolled, so then there could be an increase of school enrollment. That would be a direct outcome of building new schools. For an after-school program, an outcome might be that the students that participated in the after-school program increase their confidence in doing a particular type of task that was taught in the after-school program. Maybe it's an art program. Maybe they increase their confidence in doing art or were more artistic. Then the impact would be the next thing that comes after the outcomes. Those are the wider effects of the particular intervention. They are maybe positive or negative. They could be intended or unintended, but essentially that's sort of the broader, bigger effect. So what else happened as a result of the intervention that you used? And so essentially, an impact might be as a result of more schools being present in a particular district and more school enrollment or higher school enrollment, we then see better educational outcomes, which then contribute to poverty reduction in a particular location or a particular place. So as you can see in this example, impact is really much broader than the initial intervention that maybe targeted, a particular number of students or people in a community. So those are the sort of results. So as you can see here, you've got your planned work, which is the inputs and activities, and then the results of those activities are the outputs, outcomes, and impacts. We'll come back to a little bit more discussion on the outputs and outcomes as well later on. So outputs, in particular, are direct products of program activities, and they really can include different types, levels, and targets of services to be delivered. So it's about that direct product. So it may include information about the size or scope of the services and products delivered or produced. Maybe it will be the number of services or products delivered, participation rates, or the hours of service provided. So they're very discrete, usually very easy to count, and typically what we've been asked to report on as a result of getting funding for providing particular programs or just reporting out like what we've done to our constituents. So for example, there might be some outputs related to increased community access and participation in health promotion and primary care services. That may be, from a health provider perspective. Another output would be that there's an evaluation and measurement program in place. And so that might be an output that the Center for Social Impact takes on as we work with other organizations to define outcomes and impact measurement for those organizations. But an output might also just be the number of workshops that were attended by a particular target group. So outputs, again, very discrete. Outcomes, however, are broader than outputs. They're usually a little bit harder to measure, but they do generally tend to sort of fall in these types of outcomes categories. So outcomes can be knowledge, changes in attitudes or values, behaviors, or conditions. And outcomes can be both the expected or unexpected effects of a program, initiative, or activity. Generally, we always want the expected effects, but sometimes there are things that we just don't anticipate in terms of what will happen as a result of a program. And that's still an outcome. Even if it's an unexpected outcome, it's still an effect of the program. So those outcomes can fall in these categories, and they can affect different types of stakeholders. Let's say you're working directly with clients, but those clients that you're working with may be children, and they exist in families. And so families may experience outcomes as a result of a program that you're offering to the children in the family. Communities may also be affected by outcomes of your program. Funders, government, society overall, and even the environment. So when we think about outcomes, don't just think about the direct recipient. Think about maybe other entities that are touching the people or are sort of related to the people that you're working with. But also, you could have an intervention that's actually targeted at government or society or a broader community. So it is possible for a community to have an outcome or a government to have an outcome. Just depends on the scale of your particular intervention. In addition, outcomes can be positive or negative. So we already talked about unexpected or expected, but there might also be some outcomes that you might anticipate being positive, hopefully, but there may also be some negative outcomes that may result. You can think of a variety of examples where maybe you're developing a particular type of capacity within a group, but then maybe that actually does have a negative outcome on them. Or maybe you're trying to develop a capacity within a group, but actually, unfortunately, the intervention doesn't work. So therefore, that could be a negative outcome. So they might not gain the knowledge or change their attitudes positively. So outcomes can be positive or negative. And they also can occur at different times. So we often talk about short-term outcomes, medium-term outcomes, and long-term outcomes. Now, we often, though it seems tempting to put a time scale on what is short-term, what is medium-term, and long-term, it's really not possible for us at this point to articulate what a short-term outcome might be in terms of a time frame, because it really depends on the nature of the intervention. There could be some programs or initiatives where a short-term outcome might happen. You might already see that short-term outcome occur within maybe a month of an intervention, or even the same day as the particular intervention happens. But for other interventions, maybe that are focused on community change or broader societal change, you're not going to see an outcome in terms of maybe changed behaviors across society for maybe 3 years, a year. So it's really not possible to articulate at this point what is what the time frame is on a short-term outcome, medium-term outcome, and long-term outcome, because it really depends on the nature of the program or the initiative or the activity. And again, long-term outcomes, same thing. A program might have a long-term outcome that, you can see in 6 months or maybe a year. And then others, it'll take much longer to see that longer-term change in conditions or behaviors. So that's a little bit more detail on outputs and outcomes. And the reason I drill that home is because we're typically very comfortable thinking about outputs. Again, that's typically what our funders or constituents have asked us to report on. But outcomes are a little bit different, and I just wanted to highlight the difference between those two. And this slide is an activity that also drills that home. So what we're going to do is I'm going to, each of these in the center is either an output or an outcome. And I would just want to go through an exercise to see maybe you'll get it right in terms of getting it sorted correctly. So reduced social isolation. Let's think about that for a moment and think about whether that is an output or an outcome. All right, it's an outcome. Let's look at the next one. Visits to community center or service provider. Does that sound like an output or an outcome to you? All right. Oops. It's an output. 25 people attend awareness workshop. Does that sound like an output or an outcome? Output indeed. Improvement in family life and well-being. Output or outcome? Outcome, yep. 20% improvement on knowledge scale. Does that sound like an outcome or an output? Got a number, but does it sound like an output or something that might result from the program? Outcome, there we go. The number of audits completed. Output or outcome? Output. Increased level of confidence. Output or outcome? Outcome. And 100 people access an information line. Output or outcome? That's an output. Hopefully you got that right as well as you were following along. So now let's talk a little bit more about social impact. That's a big, broad term, and unfortunately it's not clearly or consistently defined. So as we look at the literature around social impact, there are lots of different definitions. Some folks emphasize the value that's created by a particular program or initiative that is created. So it might just focus on the value. Is it particularly important? That's one aspect of social impact. But there's another definition that focuses on the broad or long-term effects of a project or organization's outputs, outcomes, and activities. So those can include effects on people who are not direct users of a project, or effects on a wider field, such as government policy. The impact can be negative or positive, but it's really about sort of the ripple effects of a particular program. That's another way of looking at it. A third component of the social impact definition, it could be focused on the portion of an outcome change that's directly attributable to the program. So it's attributed uniquely to a program. So controlling for other influences, it's the amount of change that's directly affected by that particular intervention. So often then, in that instance, social impact is going to be a very narrow sort of sphere of influence. It's a very narrow contribution. Another dimension of the social impact discourse focuses on the positive and negative primary and secondary long-term effects produced by a development intervention. And that's actually a much broader definition. It actually kind of encompasses a few ideas. And it also assumes that impact can be direct or indirect and intended or unintended. And that's adopted by the OECD. So as you can see here, there's a couple of different ways about thinking about impact. Some of them, none of them are wrong. They're just different ways of thinking about impact. So all these different definitions kind of highlight that when you're talking to someone about either measuring impact or you're considering measuring impact, it's really important to define what you mean by that impact. What does that mean not only broadly, but then also for your particular intervention? What is it the impact that you're trying to see? Is it about the value that you're creating? Is it about the ripple effects that are going to be happening? Is it about your direct contribution or attribution? Or is it about sort of the big, broader effects produced? So next, I want to highlight some terms or clarify some terms around outcomes measurement. So outcomes measurement is all about identifying how you measure desired outcomes. So when we think about outcomes measurement at the Center for Social Impact, we think about a sort of this downward pyramid, this upside down triangle. So we think about domains of interest. So what are the broad topic areas that we're interested in? Then within those domains, we articulate particular outcomes. What is it that we want to be seeing in terms of the change? And then we think of indicators. How will we know if that outcome is happening? An indicator is just is a numeric measure or even a qualitative measure that could tell us when an outcome is occurring. And we need measures to capture those indicators. We need to actually measure that information. And so there are specific measures that will feed into indicators. So it's about identifying that upside down triangle there. That's outcomes measurement. But it also involves collecting outcomes data. Largely, outcomes data in the context of outcomes measurement and evaluation in this context is going to be largely quantitative in nature. So it'll be numbers, numeric. There is room for qualitative work in terms of understanding how particular outcomes are occurring, what are the contextual factors that are contributing to those outcomes, and you may even want to consider thinking about whether some outcomes are actually qualitative in nature as well. But for the purpose of today's discussion, let's focus mostly on those quantitative outcomes. In particular because it measures the prevalence of particular goal attributes among beneficiaries. So a couple of examples there. One example of an outcome might be that on average, a program participants had a moderate level of knowledge about financial products, but now after the intervention, they have a high level. So that's an example of an outcomes measure. Another example would be, 75% of our program participants are currently satisfied with their health. So you can see these two examples. One outcome is around a change as a result of the program. So they used to have a moderate level of knowledge, and now they have a high level. But the other outcomes measure is about articulating the prevalence of a particular attribute. So it's 75% of the participants are satisfied with X. So both of those are outcomes measures, and both of them are completely valid in this context. Really just depends on what you're interested in measuring and what you need to measure. Now we come to the term around evaluation. So evaluation is also a little bit of a complex term, and hopefully we don't have too much anxiety about the notion of evaluation. Because really all it is the systematic and objective assessment of an ongoing or completed project, program, or policy, its design, implementation, and results. So it's really about understanding what's going on in a program, how are results being achieved, and why. And it does have to be systematic and objective, and that distinguishes it from, our maybe day-to-day observations around how a program is working and if it's working. So those observations may guide us to particular evaluation questions, but an evaluation really does have to be systematic and objective. There are different types of evaluation as well, and some of you may have heard of these terms. There's process evaluation, outcome evaluation, and impact assessment, formative evaluation, and summative evaluation. So process evaluation is really all about understanding how a program is being implemented. And this can really be useful for course correction and changing the nature of a program. Outcome evaluation, however, is really focused on inquiry into why the outcomes occurred. Are they results of the particular program or activity, or was something else affecting the results? Did those outcomes even occur? An impact assessment is sort of a corollary of outcome evaluation. It's also trying to understand whether outcomes occurred, but also whether impacts occurred, and are they the result of the activity? So those are three types of evaluation, but then there's another distinction here around formative evaluation and summative evaluation. Formative evaluation is for judging the worth of a program while the program activities are forming or in progress. Summative evaluation refers to the assessment where the focus is on the outcome of the program. So formative will help us make course correction, and summative is all about describing whether the program was actually effective. So we can actually make a judgment about whether the program should continue or not. Evaluation is a process rather than a specific method or approach. So you can have quantitative evaluation methods, you can use qualitative methods for evaluation, you can do all sorts of different, you can use survey methods, you can use focus groups, you can use interviews, all different types of methods in order to evaluate something. So evaluation is a process. There is a distinction that I also want to draw between monitoring and evaluation. Monitoring is just collecting data on an ongoing basis. Evaluation is about analyzing the data to inform the judgment. So monitoring may be something that we're doing on a day-to-day basis, and we may be collecting the data, but if we're not actually analyzing it to make some judgments about whether the program should continue or whether the program should make some corrections, it's just monitoring. Evaluation is about analysis. All right, so next let's talk about why we want to measure social impact and why it's important. So we need to measure things to understand if we're making a difference. So as this little illustration on the right points out, this individual has written a blog. They've gotten 400 page views. They're making the conclusion or drawing the conclusion that they must love the blog. Earlier that day, we see, however, that an instructor is pointing out to students, okay, class, today's homework is to visit what I think might be the worst designed blog on the web. So we've got a lot of people looking at a blog. They didn't love it. They didn't think it was that great, but there are a lot of page views. So this is a conflation between outputs and outcomes, right? We see 400 page views. We make an assumption. But we also need to better understand if the blog is actually making a difference, and that's why we want to measure outcomes and measure impact. So we want to do that because we want to understand if people really are any better off. This is why we're doing the work that we're doing. We wouldn't be engaging with communities the way that we do. We wouldn't be working with people the way that we are if we didn't think we were actually, going to make a difference in their lives. So measuring outcomes and impact is actually a quintessential part of making sure that the work we're doing is actually useful and we're putting our energy into the things that actually do matter, because we care and we want them to matter. We believe that they should matter. So we want to use this opportunity to understand, if people are really any better off from our work. We want to use this opportunity to learn if people are more resilient, or maybe they feel more included and connected as a result of the efforts we're putting forth. And it's about understanding if our actions have had any impact. And again, this is why we get up in the morning, in order to have these outcomes and impacts on people. And so measuring that, we won't know it if we don't measure it. It just won't work. We can, try to use our hunches, and we can, like maybe talk to a couple people, but that's not really giving us a full picture of whether our efforts are having an impact. So what are some other reasons that you can think of that we might measure outcomes and impact? All right. There are other benefits. We measure outcomes and impacts to help us learn, to help us develop maybe ourselves, maybe our programs, maybe our organizations, maybe even society. We also measure outcomes and impact, honestly, because we want to communicate why we are awesome, why it is that we're doing a good job and that we are doing a good job. And we want to make sure that others support us, and know what a good job we're doing. And also, it can help our brand. It can help build a credibility for our particular brand or organization. Also, there is a growing emphasis on accountability and compliance from our funders, be they government, be they philanthropy. They want to know that the money that they're putting towards these programs, towards us, is actually doing any good. And so we have to be held accountable by those funders and our constituents. So there is that growing push for measuring outcomes and impact from an accountability perspective. Also, we want to make sure that we're being efficient in our work. And so measuring the outcomes and impact can help us increase efficiency if we see that particular resource expenditure isn't achieving those outcomes that we want, then perhaps we shouldn't be expending those resources. Or we might also learn that we think that not many resources are needed to achieve a particular outcome and impact, but actually in measuring it, we see that actually more resources are needed in order to achieve greater outcomes and impact. So it can increase the efficiency. And also, it does help us with organizational sustainability, given changing funding environments. The shift to outcomes-based funding, which requires a detailed understanding of what change is occurring for the people with which you work, and it's a requirement, increasing a requirement that we in order to be sustainable, we have to demonstrate our outcomes. So, and again, as this cartoon illustrates, before we invest millions of dollars, we should probably test it and see if it works. So really, that's the underlying idea behind outcomes and impact measurement. There may be other factors that motivate us as well. And you may in your organization see some of those things as well. So perhaps there's a focus on performance management and improvement in your organization, and outcomes measurement, particularly done on a regular basis, can really help with managing performance and improving an organization. There may be factors related to the competition that we face in the market. There could be other providers that are providing the same type of service that we are, and if we can inform consumers that they're going to achieve better outcomes, by using our service, then that may be a factor that's motivating your organization to focus on outcomes. Also, it does allow comparisons to be made between programs and organizations if we measure outcomes. So it may be possible now to look at different programs that are providing similar types of services, or maybe even different types of services that are trying to achieve the same outcomes, and we can actually compare our performance or our organization's performance to those other organizations and programs. So that will actually potentially help us improve in terms of how we operate and in the types of services we provide to achieve outcomes and measurements. Outcomes and impacts. So why is measuring outcomes and impact really important? Well, it provides a consistent approach that will help us clarify our outcomes and results. It'll help us inform decision making, and it will help to work with others to address wicked problems. It'll help us work with others. So wicked problems are really complicated, complex problems that are typically societal-wide, and are, not just easily fixed by one particular agency or one particular organization doing one thing. Wicked problems are really wicked. They're really challenging. Things like poverty, things like inequality. Those are really challenging things that we need to be addressing. And if we measure outcomes and impact, this might actually help us identify other organizations that are working on similar issues, making headway in certain ways, and we can actually work together to address those things. So lastly, I do want to take some time to give you an opportunity to reflect on various things that you might want to consider for your journey into outcomes and impact measurement. So there is a measurement cycle associated with outcomes and impact. And the cycle flows like this, and it starts with understanding what it is that we're trying to measure. Next, it flows on to articulating a model of your program. So how does it work? Then it involves developing an outcomes measurement framework. How is it that you want to measure these outcomes and impacts? Then it flows on to developing a data collection plan. Then from there, analyzing and developing an analysis and communication plan. Then implementing the plan, so collecting the data, communicating the results, and then continually monitoring and reviewing that process and adjusting it as appropriate. So this pathway is articulated to help you understand sort of how it is that we explore, develop, and refine outcomes measurement. And it is cyclical, as I've shown here, and it is iterative. It will change, and you'll do adjustments along the way. And you may actually, go down one path and maybe hit step 3 and then have to go back to step 2 and then flow back 3, 4, etc. So there are changes that you may want to go through as you go through this cycle. And it's really applicable across organizational contexts. So it can be applicable to a particular program or a portfolio of programs or an organization overall. And the 6 steps here are supported by various foundational capacities, i.e. leadership, learning culture, and skills, capabilities, and capacity. So we'll talk about these steps in more detail now. So the first step is really that understanding phase. So at this point, you really want to clarify the measurement needs of your organization or your program. So what is it that your organization needs to know about outcomes and impact? So what information do you already have? What evidence do you need? What level of evidence do you need? Do you need to be articulating sort of attribution, contribution, or does that not matter? What questions do you have about the outcomes or impact? So think about all that, put that together, collate it, learn from various people across the program or the organization about what it is that they need out of this measurement exercise. And reflect on the role of context. So what I mean by that is the context in which your beneficiaries might be situated might also lead you to ask particular questions. So for instance, if you're working with children or young people, those young people and children exist in a context of a family and probably a school and then a community. And each of those layers of context have an influence on that individual, on the young person or the child that you're working with. And so understanding that already at the beginning, in terms of your understanding phase, will actually help you in your measurement tasks ahead, because it will actually flag to you some aspects of the context that you may need to be paying attention to and measuring and understanding. What is, if you're trying to affect maybe educational outcomes for young people, what is the role that their family is playing on the achievement of those educational outcomes? What role is that having? What role can you maybe have on those family members as well? So thinking about that up front will really help you lay a clear path forward in terms of measuring outcomes. Also at this phase, in this understanding phase, Consider external and internal systems that you have for data collection, what frameworks may already be in place for measuring outcomes and impact, and think about what reporting requirements you already have from existing funders. Now, there may be additional information needs that your organization has outside of those typical reporting requirements. Or you may reflect and realize, you've had a legacy of maybe 10 different reporting requirements, and maybe some funders are shifting in their needs, and you may be able to phase out 2 out of those 10, what have you. But really pull together as much information as you can about what measurement looks like in your organization or your program already. What are you reporting? Who's reporting what? What systems do you have? And then in this understanding phase, think about who needs to be involved in the measurement tasks and when along this journey. So do they need to be mostly engaged in the second phase, the outcome measurement framework development phase, or only in the data collection phase, what have you? So think about that in the context of each different phase and the different members of your program or organization. And you may need to consider looking externally. Maybe you don't have any internal evaluation capacity or scientific data collection capacity, so that might be something you need to outsource. So think about that in this understanding phase. Again, that'll help you sort of identify and be really proactive as you navigate this journey. So in the second phase, program model phase, at this point, it's time to clarify the rationale for the program and identify any assumptions that you've got about why you think it will work in the way that it will. Really, that involves developing a theory of change. The theory of change is all about, is very similar to a logic model. It'll articulate what your program is doing and what the outcomes and impact you intend it to have. But it also will articulate, what the context is around your program. What else is going on? Are there policy changes happening? Are there policies that are affecting your program? Are there particular community attributes or attributes of the people that you're engaging with that might affect the program? Also, what assumptions are you making? Why is it that you think a particular action or activity is going to lead to a particular outcome? And at this point, you may actually, identify some really important assumptions that actually are pretty huge, and you actually shouldn't maybe ignore, because maybe it's revealing kind of a hole in your particular program logic. Maybe you're making a really big assumption that a particular action will lead to a particular outcome, and maybe you will realize at this point that maybe your program might not actually work because it's missing a key component. So at this point, you may actually adjust some aspects of the program, but at the very least, it's really important to articulate what that rationale looks like. Then in your measurement, you can actually be paying attention to whether those assumptions are true, whether the connections between actions and outcomes are true as well. And at this phase, you want to articulate your 3 Ps, which are your purpose, your process, and your progress. The purpose is all about what is it you're trying to achieve. Articulate that. Make that into a very clear statement. What is it that this program or initiative or organization is trying to achieve? Next, articulate your process, and that's kind of like your logic model. How are you going to achieve it? What are the inputs? What are the activities? What are the outputs? And then finally, the progress. That's really about the measurement. So to what extent have we achieved our purpose or made a difference? So that's about articulating the measurement. So at this point, you'll want to create a theory of change, as we mentioned, but then also a logic model with those inputs, activities, outputs, outcomes, and impact. In the third phase, you'll develop an outcomes framework. And in this phase, it's all about clarifying what the outcomes and impacts in your logic model really mean. So when we say community vitality is the goal of a particular program, what is community vitality? You're probably asking yourself that question right now. Well, as I was working with a particular organization who had identified that their long-term outcome was community vitality, I had to sit with them for about 6 months. Now that was particularly long for this organization, but it might be shorter for yours. But what is it they really mean by community vitality? Well, for them, it actually meant, based on our series of conversations, it meant communities that have capacity to get things done, and realize a balance of positive social, economic, and environmental outcomes. So that actually helped articulate, so what is community vitality? But even within that, what's a positive social outcome? That could be pretty much anything. Positive economic outcome, again, that's really broad. So in my work with them, this was articulating their outcomes framework. I had to work with them to identify what an indicator of particular positive social outcome might be. And for them, one of the outcomes they were trying to achieve was, or one of the ways that they identified or defined positive social outcome was in terms of educational attainment, for instance, for the community. And so increased educational attainment, or the increased percentage of adults with high school or greater education, that became an indicator of that outcome around educational attainment, but then also positive social outcome. So that's what the indicator was for them. That's what you do during this phase. And then also the next part of this phase is selecting those valid measures. So how is it that I'm actually going to know if adults in a particular community have greater than a high school education? Well, there are particular census questions that actually ask about that. So that would be the valid measure I would use to generate an indicator of positive social outcomes. So in this outcome framework phase, you can see that there's quite a bit of work involved with this. It's really articulating what we mean by various phrases and identifying how we can measure those things. How will we observe them? How will we know if they exist in our either beneficiaries, our communities, what have you. So this phase can be quite long, and also this phase will set the stage for all your data collection and all of your analysis. So you don't want to give this short shrift. Spend the time, do the work in the outcomes measurement framework phase. The next phase is all about articulating your data collection plan. So here, only plan to collect what you will use. Please do not waste people's time collecting information that you think might be interesting, but that won't actually tell you anything about the effectiveness of your program or whether your program is achieving the outcomes. So really do keep yourself focused and keep your colleagues focused as well. People who may be working with you in this phase who might not have been on the journey the whole way with you, help them stay focused. Because again, where you're going to be asking people for information and people's time is precious. You don't want to take that time asking them questions that might not be useful. So at this phase, you're going to want to think about your data collection methods. And remember that outcomes can be measured many different ways, particularly in the context of outcomes evaluation. So you can measure outcomes using a questionnaire or a survey, maybe that you design in-house, or maybe a survey that's designed by a survey design expert externally. Also, you can use interviews as a data collection method, or case studies where you're looking at particular units, so either maybe a particular beneficiary, small number of beneficiaries, or maybe a small number of communities, and analyzing how they've interacted with your program. And you're not trying to draw inference about the generalizability from those case studies. What you're trying to do is get a deep, rich understanding of how those particular people intersected with your program, but then intersected with the wider community around them, or with their families, or with their schools, etc. And so case studies can provide a really rich source of information around how is it that program's working, how is it functioning. So think through the data collection plan carefully, and be sure to draw on resources outside of your organization for ideas around data collection. In the fifth phase, there's analysis and communication planning that has to happen. So figure out how you want to approach the analysis of data. Are you going to use statistical methods? Are you going to use descriptive methods? Are you going to use qualitative methods? And also think about the channels that you want to use for communicating your results and how you're going to engage different people along the way. In the implementation planning phase, you'll want to actually be developing a plan for how your organization is going to roll out outcomes and impact measurement. Are you going to pilot it first, or are you going to roll it out across the whole organization? Are you going to build capacity among existing staff to do data collection and measurement and analysis? Or are you going to hire new staff with that expertise? Or maybe you'll procure consultants to do that for you. Also in this phase, identify if there's any work that's needed to improve the measurement or learning culture of the organization to help in that implementation phase. And then finally, implementation, right? At this point, you're going to be measuring your outcomes and impacts. You're going to be communicating your findings. You're going to be adjusting any measurement activities if you need to, because as you may have thought that a survey was going to be the best way to gather this information from maybe your young people that you're working with. But actually, as you roll it out, you have very little participation in the survey, maybe 10% response rate. That's not very good. And you realize actually, as you're working with young people and you see them interacting, that maybe actually a text-based data collection tool might be better. And what you had been using was maybe an online survey. So at this point, you might have to go back and actually adjust your data collection plan. So that's part of this iterative process through implementation. Also, you may realize that in your communication, you had a detailed communication plan laid out, but in the reality, it may need to be adjusted. You might need to be communicating with different types of stakeholders differently. So at the implementation phase is doing the work, but then also making any adjustments if you need to. So that's the outcomes and impact measurement cycle, things to reflect on in your journey, but also some other questions you might want to reflect on. So are the expectations for outcomes measurement understood within your organization? Are the internal and external expectations understood? Does your organization support failure and learning? Are there supports and expectations in place? Because through this process of outcomes measurement, you're going to learn what processes, what supports are in place to make sure that that learning happens in a productive way and not in a negative way. What would it take to develop a common language and understanding of the key terms for outcomes measurement across your organization? Do they all need to be, do you have regular in-services? Is there an opportunity to develop that common language? Where do you think your organization is in regards to readiness for outcomes measurement? As we see, funders are increasingly asking for outcomes measurement, but is your organization really ready? Do they have the systems in place? Are they ready to support that learning? So those are other questions to ponder as you engage in this more and more. Next, or finally, I do just want to tell you about a future resource from the Center for Social Impact. It's called Amplify Social Impact, and will hopefully make all this outcomes measurement work a lot easier. So really, it's a technology platform that will be starting to be launched in 2019 and will roll out from 2019 forward. And it's designed to answer some critical questions. First, where are social problems acute and amongst which populations? That will be revealed through the Australia Social Pulse tool and our Social Progress Index that'll provide you access to really deep, rich data and data visualization tools to understand social issues and track social issues across time, across communities, and across cohorts or populations. Second, the platform will help us understand how we know if we're impacting the problem. Indicator Engine will be able to provide you access to the tools and guides that you need to measure the outcomes that you should be measuring for your organization. These guides will be very concrete and tangible. It'll tell you exactly what questions you need to be asking among your clients and beneficiaries about the outcomes that they should be achieving. It'll provide you guidance on the methodology to use to collect that information. And finally, the tech platform will answer a critical question around, are our strategies and interventions working and worthy of replication? And by our strategies, I mean strategies that are being implemented across the sector, across nonprofit groups, across government groups, across even private sector groups. So Yardstick will be able to provide you access to benchmarking tools around outcomes and impact. So it will provide you a source of information around which programs or a number of different programs that are trying to work towards similar outcomes and what level of outcomes they're actually achieving. It'll help you understand whether your program is working, and also whether it's worthy of replication, i.e. it's achieving great outcomes, better outcomes than other organizations or programs. So look forward to sharing more with you about Amplify Social Impact over the coming years. So thanks so much for your time and your attention. Please don't hesitate to contact me or anyone else at the Center for Social Impact at University of New South Wales with these details. Thanks so much and have a great rest of your day.